Hi, my name is Alicia Knoll, and I am a student of physical therapy at Regis University, and today I will be giving a brief education on pain. So, first off, what is pain? Pain is sometimes referred to as that sharp, tingling, throbbing, aching, or even burning and uncomfortable feeling that typically occurs as the result of injury or illness. You may feel it when you break a bone playing a sport, burn your hand while cooking, or after you gotten stung by a bee. Pain can be classified as acute, in which there is the presence of tissue damage and a defined onset due to a clear cause and effect, such as when you fall off your bike on an outstretched hand and break your wrist. Pain can also be classified as chronic. This is when there is no longer tissue damage because the tissue healing process has already taken place, but yet there is somehow still the presence of pain. I'm sure many of you know someone who has had some type of persistent pain, such as low back pain that they have seemed to try everything available to get rid of but just can't quite shake it. This is referred to as chronic pain. The main difference here is that acute pain is a symptom, but when the pain becomes prolonged, it becomes the disease. Although it may not seem like it, pain is incredibly important. Pain is a protective measure in that it warns the body when there's a potential for damage, such as when you lean up against a hot object and your body immediately signals for you to move away or even stop, drop, and roll if necessary. In this way, pain works to prevent further damage. However, this concept might not always be so cut and dry. Sometimes pain can occur in the absence of damage or injury to the tissues. On the other hand, there are times an individual may feel little to no pain despite sustaining a severe injury. For instance, surfers who have had their leg bitten off by a shark have testified that they merely felt a bump at the time of incidents. Now that's crazy. Nevertheless, this points to the fact that the way in which pain is perceived is extremely complex, context-specific, and personalized. So why is this? Well, the severity of pain one experiences is really dependent upon how the brain perceives it. If the brain believes that what is happening is a threat or danger, it will be accompanied by pain. However, if an athlete that has just led his team to a national title and subsequently gets trampled by his teammates and breaks his arm, might not feel the pain due to the pure elation he feels in that moment. In this way, pain has an emotional component as well. Some of you might be wondering how the brain even receives this information in the first place. So let's discuss this process. Throughout our brain, there are a countless number of sensors or receptors that pick up activity or stimulation from the environment or inside your body. There are a variety of different types of sensors that serve specific purposes. For instance, there are mechanical receptors that are activated when there are changes in pressure, as well as chemical, temperature, and light receptors that suggest what they respond to. When a stimulus presents itself, the sensors open up and allow positively charged particles to enter the neuron, which is a transporter of information that ultimately gets sent to the brain. If the signal is strong enough, the neuron will send a message to the spinal cord and brain using electrical and chemical signaling methods. The brain then collects and summarizes the messages it receives and combines them to form one pure sensation. Although the impulses themselves do not change, there can be a lot of variability in how hard or easy it is for the messages to be sent depending upon the chemicals that are present at the neuron. Because of this, the brain can perceive the same stimulus differently at various times. There are some long-lasting changes that occur, which may make it possible for the brain to still experience a sensation from a stimulus that either no longer exists or is very weak. Education and awareness of the processes at work behind a painful sensation are surprisingly powerful tools to help alleviate the feeling itself. The fact that there is a logical explanation for why you feel this unpleasant sensation can be reassuring, as it is often the uncertainty and fear that can contribute to increased pain. In situations where the pain is long-lasting, other methods may be employed to help resolve the issue. Many of the physiological changes that are associated with long-term pain can be reversible if handled properly. As therapists and patients work together, they are able to find personalized solutions that allow the patient to slowly recover at a comfortable pace and intensity. Physical therapists know that movement is one of the greatest forms of medicine, and this still rings true when it comes to pain. The key is to build off of a non-painful baseline and work with patients to recover the functional abilities that they had possessed before they began to experience the pain. I hope this video has given you a better understanding of pain. Thank you for your time.